Yeah.
An essential part in airway management is positioning the patient. So if the patient was on the floor or on his side or her side, they need to be turned around, especially when there's no trauma. We need to have spinal precautions. And we have two maneuvers to open an airway. One is the jaw thrust maneuver, and this is achieved by applying pressure on the posterior or rim of the rami of the mandible, using your thumbs as a base to push the lower jaw or the mandible up. And this maneuver is applicable in both trauma and non-trauma patients. Second maneuver, which is applicable only if we have a non-trauma airway patient, is the head tilt and a chin lift.
Yeah.
Two essential airway adjuncts that we use for airway management. One is the nasopharyngeal airway. And to use the proper airway or nasopharyngeal airway, you need to get the right size. And you measure the size from the nostril to the tragus. This is possibly a little bit shorter than it should. Okay. And to insert it, you definitely have to lubricate it properly with gel, and the insertion will be horizontal or downwards position, avoiding the littles area, and with a spiral movement it should go in, and it stops at this adapter. If you have chosen the right size, the tip should end at the second adjunct is an oropharyngeal airway, and to use the right one you need to choose the right size. Size starts from, you can measure the size starting from the incisors to the angle of the mandible. So this is the angle of the mandible. This is possibly the right size for this mannequin. To insert the oropharyngeal airway, you need to use a tongue depressor. Tongue depressor down, oropharyngeal curved